A feminist analysis of pandemics and public health must be intersectional. It should recognize the structural hierarchies, discrimination, inequities, and the intersections of gender, race, caste, religion, ethnicity, gender identity and sexual orientation, disability, migration, refugee status, work, and other structural determinants. An intersectional feminist framework demands for a public health system that is equitable, inclusive, accessible, affordable, and accountable. An intersectional feminist approach recognizes that pandemic-related policies are embedded in political processes, and that states, global corporations, including the healthcare and pharmaceutical industry, as well as actors in the global trade ecosystem, play a dominant role in policymaking. A feminist framework demands that pandemic-related policies and decision-making must include diverse voices and perspectives of people, particularly the marginalized, which are often ignored in policymaking. Pandemic-related lockdowns have taken a deep toll on people's livelihoods, emotional and psychological states, causing trauma, anxiety, and depression. Further, the language of social distancing has undoubtedly reinforced various forms of ethnic, caste, and racial discrimination, social exclusion, as well as stigmatization. A feminist approach demands an effective public health response that is inherently caring, non-discriminatory, non-authoritarian, democratic, striving to uphold and respect dignity and human rights. To be truly responsive, policies must take into account context, use gender transformative life course frameworks, and take seriously the interconnectedness of issues like food, livelihoods, social security, sexual and reproductive health rights, gender-based violence, and structural inequities. Frontline community health workers and sanitation workers played an important role in providing care for communities during and even before the pandemic, yet they were the least cared for by the health system. A feminist framework recognizes the informal and precarious nature of their work and demands social protection, dignity, safety equipment and measures, and just remuneration for these workers. Evidence shows that higher income countries, through pre-purchase agreements, manufacturing monopolies, and the exercise of intellectual property rights, hoarded huge stocks of COVID-19 vaccines, while poorer countries are still waiting, in what has been termed a vaccine apartheid. A feminist framework recognizes the urgent need to address global and local inequities in the production, distribution, and sharing of technology and know-how related to the supply and distribution of vaccines. We as feminists decry the privileging of the virtue of charity, which is counterproductive to the language of rights and dignity. Our feminist response urges reconceptualization of aid or charity and philanthropy for health as a legitimately owed international obligation and reparation under human rights principles, rather than fragmented support offered as kind acts of paternalistic protectionism. A feminist framework demands that state and non-state actors work through a multilateral system towards redistributive justice, the cancellation of outstanding debt of countries, the withdrawal of austerity measures, and the suspension of restrictive global trade agreements to address the crises exacerbated by COVID-19. An intersectional feminist approach post-pandemic must institute systemic change in the global health architecture by advocating for equitable access to diagnostics, vaccines, treatments, other therapeutics, and by revoking patents. The COVID-19 pandemic calls for solidarity, not division. Collective action, not unilateralism. Sadly, this public health emergency has been treated as a profiteering opportunity, giving rise to pandemic billionaires. In contrast, an intersectional feminist response to the pandemic reiterates the need to put people first and to make their needs the bottom line. Vaccine hesitancy must be addressed and overcome through sustained attempts to build and keep public trust. It should include fair, transparent, and reliable information about how clinical trials are conducted, the basis for approvals of emergency use authorization, the possibility of adverse events and how they may be remedied. Comprehensive, reliable, and regular public health messaging is essential to quell rumors, dispel myths, and mitigate misconceptions about vaccines and their effectiveness. Data indicates that in many countries, more men than women and trans women have been able to get COVID-19 vaccination. The inclusive way forward is to recognize and address the role of gender, patriarchy, the digital divide, as well as socio-cultural and economic inequities, and to ensure access to vaccines and affordable life-saving treatment. An intersectional feminist approach to the post-pandemic future must ensure increased state investment in public health and in the social determinants of health and promote universal healthcare. Ensure data on gender, sex, disability, as well as other key indicators. Build a new multilateralism to achieve social and economic stability, environmental sustainability, and gender equality. Ensure human rights and fundamental freedoms as well as social justice for all through collaborative regional and global action as well as solidarity. Strive to build a world where empathy, collaboration, resilience, and transformative justice are valued at all levels, from the individual to the community. Make linkages between the very personal and the global collective struggles, recognizing the complexities and limits of overcoming barriers and bringing together intersectional identities. Build global solidarities to create new solutions and adopt appropriate responses to forge a different way forward, given that the pandemic is not yet over.